People with high cholesterol can generally eat nuts like almonds, walnuts, and pistachios without concern, and in many cases, these nuts can be an excellent part of a cholesterol-lowering diet. Rich in unsaturated fats, especially monounsaturated and polyunsaturated fatty acids, these nuts contribute to healthier blood lipid profiles by reducing LDL cholesterol while leaving HDL cholesterol unchanged or slightly elevated. Walnuts, in particular, are high in alpha-linolenic acid, a plant-based omega-3 fatty acid that may offer anti-inflammatory and anti-atherogenic effects. In addition to healthy fats, these nuts contain plant sterols, naturally occurring compounds that structurally resemble cholesterol. Because they compete with dietary cholesterol for absorption in the intestines, plant sterols can modestly reduce the total amount of cholesterol entering the bloodstream. Nuts are also a good source of fiber, magnesium, L-arginine, and various polyphenol, all of which may contribute to improved endothelial function, lower blood pressure, and reduced oxidative stress, factors that further support cardiovascular health. There is strong clinical evidence to support the cholesterol-lowering effects of nut consumption. Randomized controlled trials and large observational studies have shown that incorporating a handful of nuts into the diet several times a week can lead to modest but meaningful reductions in LDL cholesterol and total cholesterol. The benefits seem especially pronounced when nuts are used to replace less healthy snacks or saturated fat sources, rather than simply being added on top of an already calorie-dense diet. Still, some caution is needed. Nuts are energy-dense foods, roughly 160 to 200 calories per ounce, and overconsumption can lead to weight gain, which can worsen cholesterol levels if not counterbalanced by physical activity or dietary restraint elsewhere. Additionally, many commercially available nuts are salted, candied, or roasted in unhealthy oils, which can counteract some of their cardiovascular benefits. Choosing raw or dry roasted, unsalted varieties is generally the best option. It's also worth noting that individual responses to nuts can vary. For some people with specific lipid disorders, such as familial hypercholesterolemia, diet alone may not be enough to manage cholesterol, even if nuts are included. In these cases, nuts can still be part of the dietary pattern, but they should not be seen as a replacement for necessary medications or medical guidance. In summary, most people with high cholesterol can safely eat tree nuts like almonds, walnuts, and pistachios, and doing so in moderation may even help bring cholesterol levels down. Their combination of healthy fats, fiber, and bioactive compounds make them one of the most heart-friendly snack choices available. But like all good things, they work best when integrated into a balanced diet, used to replace less healthy options, and consumed mindfully to avoid unintended excess.